I'm James O'Neill. I'm an emergency physician at Wake Forest Baptist Health, and I'm presenting a heart rate algorithm to predict high-risk children presenting to the Pediatric Emergency Department. I'd like to thank my co-authors. This project started with a clinical hypothesis when we noticed that children under the age of 3 diagnosed with urinary tract infections often had triage vital signs of a tachycardia that was out of proportion with what we expected. We wanted to see if this out of proportion tachycardia was potentially a risk factor for having a urinary tract infection. We care about urinary tract infections because they can lead to sepsis and more dangerous infections. It's also a little bit difficult to determine whether the patient has a urinary tract infection or not. Children can't give us the same symptoms as an adult, and it also requires a catheterized sample most of the time, and that's uncomfortable for the child. So the design of the study, we use our translational science data warehouse. We're able to get patients for the last 8 years that presented to the emergency department, and we were able to get 34,000 patients, and we selected these by patients who were under the age of 3 presenting to the emergency department with a temperature of 100.4 or above. The information that we collected, we got their heart rate, their age, temperature, these diagnostic codes to figure out if they had a urinary tract infection or not, and we also were able to determine whether they were admitted or not. We performed a linear regression with 80% of the data set for algorithm development and 20% for algorithm testing. The algorithm that we determined is as follows, based on the temperature in Fahrenheit and the age in months. This is a visualization of the data. We have a scatter plot with 2 planes. Between the planes is the low-risk group. Those are within 1 standard deviation of the algorithm's expected value. The above the red plane is going to be the high-risk group, and that's greater than 20 heartbeats per minute above the expected value. The low-risk group between the planes had an admission rate of 10.6 and a UTI rate of 1.74%. The high-risk group above the red plane had an admission rate of double that of 21.8% and a UTI rate of 3.03%. Conclusion of this is that patients that have had initial triage heart rate 1 standard deviation above the expected value for fever had significantly higher levels of admission and UTI.